Okay. So, to help us get through some notes and to help you guys have a chance to go back over them again, even if I'm not standing in front of you, what I'm going to try and do is basically record me talking through the slides, just like you would see in class, but I don't have to physically stand in front of you or if you miss a school day for being sick, you can watch this as well. So we're going to talk about the vertebral column today and um, the pelvic girdle and the shoulder girdle, like your shoulder scapula and things like that. So the first set of slides is the vertebral column, as you can see on your screen, and the notes look like. Apparently, it doesn't like if I do the white thing. So apparently, yeah. Apparently, if you hold a white piece of paper up to your camera and you have the background blocked, it blocks out everything. Today I learned. Okay, anyway, you need the vertebral column notes. All right, so let's get into this. So your vertebral column. This is where you let me click computer. There it goes. Okay, so kind of talked about this before in class, but basically there's a lot of different words I can use to describe this structure you're seeing here on your screen. I could say backbone, I could say your spinal column, I could say your spine, I could say your vertebral column. All of those are fair game. Okay, you may see different variations of the wording on a quiz or a test, but they are all the same thing. It's just depending on my mood when I write the question. Now, this structure itself is not the spinal cord. Okay, so the spinal cord is going to be, remember that bundle of nerves that's inside the vertebral column, inside the spinal column. You don't want anything to happen to that set of nerves because it is controlling so much of not everything that goes on in your body, right? So it connects to your brainstem, that connects to your cerebellum and your cerebrum and your head, your brain, and it's then it branches out from your spine here. It branches out into all your different peripheral nerves that go all the way down to your little tip tops of your fingers, to your toes, and those send and receive signals so that you can, interpret the world around you. So we do not want anything to happen to the spinal cord. If something happens to it, we are going to have things that could be very negative on our impact for quality of life, like paralysis or changes in respiration and breathing and heart rate and not good things. So we want to make sure this spinal cord is well protected. That's why it's tucked nice and neatly inside, and it runs literally the length of this vertebral column here. So if here is a top-down view of one of the vertebrae, just a single vertebra. And so this area right in here is basically like the opening of where the spinal cord fits through. Make sure I have everything here. Okay. So again, all these words are fair game. Just know that they're all the same thing. Okay, so obviously you can tell this is, if you remember the little single view I just showed you, because there are lots of different bones here. But how many bones would you actually say this is in a mature column, meaning an ossified skeleton, that we are done developing new bone, right? We have grown, we have fused different bones together. Um, how many would you say there is? Just take a guess and kind of make a note in your brain, because, obviously I'm not actually talking to you right now in real life. Is this how Instagram influencers feel? This is weird. I don't like this. Okay, so in a mature individual, you're going to have 26. If you are not a mature person, meaning you are still growing, okay, so at birth, you have 33 in this particular segment of your spinal cord. Words. This protected part of your skeleton, you have 33. Okay, remember we talked about how the number of bones you have decreases over time because ossification. So basically, a couple different areas we're going to talk about here toward the end, the sacrum and the coccyx, those start off as 5 bones and 4 bones respectively, and they eventually fuse together. So like on a quiz or a test, I would just ask you how many is there for a mature um, column, okay? If you remember that there's 33 when you're born, fantastic, you're amazing, do great things. But for a quiz, just know it's 26. Okay, and we talked about different types of bones before Christmas break, so I know it's been a minute. But remember, we had different shapes of bones. It's kind of how we identify them, so they help. The shape influences the function. That's like a main takeaway key in anatomy and physiology. Is the shape influences the function. So, like long bones, that's gonna be like your leg and your arm bones, right? Irregular bones are like some of your skull bones. That's your sternum right here. short, they're short. And sesamoid, this is your patella. So for your vertebral column, we are talking about irregular bones. Remember, those are the ones that are just so weird shaped, they didn't know what to do with them, so they put them in their own little box and said, you just go sit over here now. Okay? All right, let's get into this. So the vertebral column, again, backbone, spine, spinal column, 26 irregular bones. All right. Now imagine, say this person somehow has their spinal column removed. They're still alive. They still have a spinal cord. What happens to them? What effect is this? Other than the fact that the spinal cord is very much possibly going to be damaged because it is just there, right? It has nothing protecting it. You're not going to be able to maintain posture, like sit up straight. You're not going to be able to stand up straight. You're not going to be able to sit or stand up, period. You're just going to kind of like a blob. You're not going to be able to like move your arms and legs. You're not going to be able to do a whole lot of basic life functions. Not saying you'd be, but you would not be able to do a whole lot and you'd be at risk for great injury. So treat your spinal column nice. All right, so as always, we talk about what the functions of these different bones are, just to kind of give you a broad view of how this all works together. Just like in general for the skeletal system, one of the functions of this particular part of it is to support your body. In particular, really supporting the upper body, okay? Because if you notice from the previous slide, it is a connection point for a lot of different places on your skeletal system. It's obviously protecting that spinal cord. And again, it's providing attachment. So it's not just attaching straight to your brain and your skull, excuse me. It's also attaching to your pelvic girdle. It's your arms help connect to all this thing. Like it's attaching to everything, right? It's like one of the main things on your body. Okay, and if you'll notice, despite what, a lot of people will say, stand up straight, sit up straight, it's good for your back. Um, your back is not perfectly straight. Even in a healthy individual, this is a healthy spine right here. This is perfectly fine. You'll notice it has a curve to it. That is for by design. Again, the shape influences the function. Okay? The reason it is curved slightly, not majorly, we'll get into that later, is because when you have a curved structure, it helps distribute the weight and forces on it. So you put a lot of force on your spine and on your bones every single day by moving, running, jumping, walking, sitting, all that good stuff. And you don't want to put a ton of force on something that is straight up and down. Okay, so say your spine was just completely straight up and down, like that's like this edge of the screen here. It is not going to be able to absorb as much impact and as much shock as this nice curved structure here. So, and then you would actually be at greater risk for injury and health concerns and, may probably a lower quality of life overall if you didn't have this nice curve. So you can see it's distributing the pressure. And here's an example in real life for engineering. We use this as well when designing bridges, when designing different components to housing. Okay. There's a reason a lot of rooftops on houses are not flat. Okay. They can't support as much weight, especially if you live in an area that gets a lot of snow. If you have a completely flat roof, that snow just packs on there. And because it doesn't have any give to it, any curve, like a kind of pointed roof that we are typically see, it could collapse. It's not good. So curves in engineering and architecture can actually help distribute forces and displace weight. It's a big thing. So today you learned some physics. Congratulations. Pat yourself on your spinal column. You learned physics. Can you tell I'm tired? Okay, cervical vertebra. So again, we're going to go by color coding on these. Very helpful. So these are the very top vertebra. These are your neck. Okay. You'll notice just in general, as you follow the pattern, we go from really, really small to really, really big. Okay. So there are 7 in your neck. These are all cervical vertebrae. And again, they're obviously the smallest, as you can even just look at it and see. And we go from the very smallest to like the largest of the smallest, if you will. So this very first one, C1. So we abbreviate vertebra by the first letter of the section. So in this case, C is for cervical. And then we count one, two, three, four, and so on and so on. So if you can remember the letter of the section and you can count, by God, you can figure out what vertebra I'm asking you to look at. Okay? So we've got seven up here. We start with C1 up here at the top. So C1 is the one that's supporting your head. This big old wonderful thing that's helping you think and understand what I am saying. All right. Your head is actually rather heavy. It needs a good support. All right. So this C1, also known as atlas, is what is supporting your head and it's articulating with the occipital condyles, those little bumps that are on the base of the skull I showed you. Okay, why am I pointing? You can't see that. These little things down here. So remember, articulation means joint. Joint indicates movement. So this lets you move your head. So I am using my C1 vertebra by doing this right now. Okay. And Atlas, the reason we call this one Atlas and not just C1, we can call them both, but typically doctors are going to use C1, C2, whatever. But Atlas is also named for a mythological being. So if you remember your Greek mythology, there were the bad guys, the Titans, right? Not good, not good, right? So one of them was named Atlas. And once the Titans were conquered by the gods, Zeus and all his siblings, Atlas's punishment was to literally hold up the sky, hold up the heavens on his back and kind of like across the back of his neck. So he was holding the weight of the world essentially on him, on his neck, on his back. So that's why we call this Atlas, because it is such an important critical support right in this area for this particular vertebra. Yes, okay. Sure, I got everything. Okay, then we go down to C2 because it goes one, then two. Yeah, right. You're following me now? So we have Atlas, then we have axis. So the Earth spins on an axis, right? It moves. We call this one axis. So what do you think it allows you to do? Lets me do my head like this, right? I can move my head side to side. I can spin my head on its axis. Not all the way around. That's bad. Don't do that. Um, we're not owls, so obviously there's a restriction limit here, but we can move because of these knob-like dens on the particular vertebra in question. This axis is C2. So when you move your head no, you're activating C2. When you shake your head yes, you're activating C1. Activating, whatever. So okay, then we have the thoracic vertebra. So hopefully you remember what thoracic means. So now we're getting into the chest area. Okay, so if you just look at this picture, I bet you can figure out what it's connected to, right? It's connected to your ribs. So there are 12 of them. So this was C1 through C7. Now we're getting into thoracic vertebra here in the yellow. You'll notice they're getting bigger. Again, as you go down, they get even larger. And there are 12 of them. So we go T1, T2, T3, T4, and so on and so on. I'm not going to count to 12 because I think you know how to do that. So they are connected to the ribs. We call these like the medium-sized vertebra. I mean small, medium, large, whatever. Um, so if you have ever been to the chiropractor and they did any adjustments, they may have especially been targeting this area. These are very common chiropractic adjustment areas is in the thoracic vertebra. Um, so you may be somewhat familiar with them. It just depends on your health experience. All right, then after thoracic, we have lumbar. So we had C1 through 7, T1 through 12, and now we have L1, 2, 3, 4, and 5. We are too fast. They are the largest. Okay, in this case, they're the ones in orange there. So the mnemonic that helps people remember how many are in each section. Okay, so it's breakfast at 7, lunch at 12, dinner at 5. Breakfast at 7, 7 cervical. Lunch at 12, 12 thoracic. Dinner at 5, 5 lumbar. Okay, so the lumbar is your lower back. So you will probably see a lot of different, like if you are into gaming chairs like I'm sitting on, but you can't see, it's here. So a lot of those gaming chairs and office chairs and stuff, they'll advertise like lumbar support. Well, that's because this part of your spine can, you look at how much, pressure it's dealing with. It's at the very bottom, right? So it can get fatigued, it can get sore, it can get painful, especially if you have a sedentary office job or you're like a gamer who sits in a chair a lot. So these different chairs will add support in this particular region of the chair, like at the very bottom. Like on mine, there's a pillow down here, so that this particular spine gets a little bit of reprieve from some pressure. All right, then we have the sacrum. So in this case, it's this green section here. So this is what is attaching to your hip bones, your pelvis. So this is a side view, right? It's this green section here. Not very descriptive in a sense because it's kind of the side view. But if you look at the front, it's going to be like this section right in here. So this would be some lumbar vertebra. And then here is this sacrum right in here in the middle. Now, it is not including this little tail, this little triangle coming off the end. That is a different part. Different part. I can speak, I promise. Okay. So your sacrum is, I just remember it because it's kind of this weird, it's not quite a perfect triangle, but it's close. You know, it's like it's like they made a good effort to draw a triangle and they failed. Um, so this is also an articulation point, meaning joint, meaning movement. Okay. So it's connecting to L5 right up here and your coccyx, which is down here. Okay. And it's so on the pelvis itself, there's something called the ilium, which is like these big parts over here. It's also connecting to all that. So you see how many different connection points or articulations we have in this one part of the vertebral column. Okay. If you are super interested in learning things, so part of the pelvic bones, there's something called the iliac crest, and this particular joint right in here is called the sacroiliac joint or the SI joint. Fun fact. That's another thing that can be kind of stressed or damaged with student athletes or adult athletes. You gotta take care of your bodies, guys. Gotta stretch and all that. So this is the one that starts off as 5 when you're like an infant. Okay. This whole section is like actually 5. And then eventually by the time you're my age, 30 and over, we're old people here, it'll fuse to 1. So you all watching this, your age, you're in the middle. Okay. All right. And then below it, we have the coccyx. Okay. It's the purple little guy down here. It's this very end down here. Okay. It's commonly referred to as the tailbone. I'm sure you've heard of that. Like if you fall really hard on your butt, you bruise your tailbone, that's what you hit. Okay. So again, it was originally 4. By the time you're old and gray like me, it's about 1. It's 1 bone. Okay. Um, this does help a little bit with supporting like your pelvic organs, so your reproductive organs, but it doesn't do a whole lot other than that. So there you go. All right, so some things to keep in mind with the spine. I gotta make myself sit up straight now. So it's not just bone on top of bone on top of bone on top of bone, right? We've talked about how that would not do well because bone wears down. Yes, bone can be replaced because osteoblast, osteoclast, all that good stuff we talked about, but you don't want bone just grating against each other all the time. It's one, it's painful, ow, and two, it wears your bones down very fast and makes kind of the whole rebuilding process even more cumbersome. So in between, like in this picture, it's the little blue gaps here. In between the different vertebrae, there are something called intervertebral discs. Inter meaning between, vertebral. Gee, I wonder where it is. And they're discs because they're circular shaped. So these are made of a type of fibrocartilage. So remember, cartilage can help absorb some shock, gives and takes, things like that, right? And it can be kind of stretchy in a sense, it's cushiony, right? Kind of like how your nose is kind of cushiony, right? Granted, that's a different cartilage, but either way. So think of these as like padding. They're going to, one, yes, your spinal cord or your spinal column is absorbing a lot of shock from you existing, but this is like the padding in between. So if you're moving, you put everything in a box, right? And all that stuff is fragile. And you want it to get to the next destination. So that's your spine. Like it's protecting the box is the spine. It's protecting the fragile stuff, which is your spinal cord inside. But if you want to help protect everything even further, what do? You add padding around your stuff, right? That's what these are. So, or you can think of them as like shock absorbers. We talked about a lot of different analogies, like with cars and stuff this year. So think of them like that. Um, these actually can expand and contract a little bit. So you can be like when you stretch out, like especially when you sleep for overnight, you kind of stretch out a little bit. So you're a little bit taller first thing in the morning. Bit. But if you really want to see your height change, go become an astronaut and go to space. Because what happens when the astronauts go to space, so the force of gravity is not pushing down on their vertebral column, so it stretches out. And astronauts grow like an inch in space. And that used to be a requirement for why they had to be under a certain height, is because one, you got to fit in your spacesuit. But you also have to fit in your spacesuit, one, when you leave Earth, and two, when you're using it in space after you've been kind of stretched out by the microgravity not pushing down on your spine. So it's less of a concern now because they have better spacesuits and things like that. But either way, you still grow in space. The problem being, when you come back, it doesn't stay that way because now we're back under 1G Earth gravity and it's pushing down on your spine. So a lot of astronauts, especially the ones who've been up there for 6 months to a year in microgravity, they come back and they have to deal with severe back pain for a while because they're just boom, right? So they're readjusting and kind of going shrink. They're literally shrinking. Um, so something to look forward to if I ever get picked. But kind of cool to think about. We have these cool shock absorbers, and you kind of stretch out a little bit. Okay, so I already talked about how we have curves here, right? You'll notice it kind of has four distinct curves. So we just kind of follow it. All right. Excuse me, I had the hiccups. So we know they're separated by these discs. We know we have curves, cervical, thoracic, lumbar, and sacral. And you can see the different regions here labeled for you, nice and neat. The curves are labeled exactly for the region that they're in. We're not trying to trick you here, okay? Now, this is a normal curve, right? This is what it's supposed to be. But we are seeing, um, we've always seen. Yes, my phone made a sound. Please go yell at the neighbors. Thank you. Um, so a more recent issue we are seeing with different, or I should say, inappropriate or bad curves of the spine. I'm talking. Is something that is appearing more and more in youth, your age, okay? And even if I didn't tell you this was called text neck, what is this person doing? They're staring at their phone. This is what I see when I look at my classroom sometimes, and y'all are like, oh, phone. Okay. One, I worry about your brain because of your attention span being shrank by mindless videos. But I also worry about your neck because I see some of you, there is very little space between you and your phone. And I don't think it's because you're like me and you're blind. Okay? It's like when I don't have my contacts in, guys, like I'm holding my phone like this close to my face, going, I can't see. Um, you guys if you do this a lot, if you hold your phone like this and you're always on your phone, you may start to notice your neck hurts because, again, your head is heavy, 10 to 12 pounds, right? You've got your brain, you've got the skull, you've got muscle, you've got nerves, meninges, all this stuff. Okay, there's some fluid up here. That's heavy. And your neck is designed to keep it at a right angle. I mean, right isn't correct, not right as in 90 degrees. Um, to best support that, because that's how we have adapted. We have not adapted to be slumped over phone looking at cat video. So you'll notice your neck starts to hurt because look at the curvature of this guy. He's at a 60-degree angle. So now he's got this bad curve going to his neck and it's starting to get closer to his shoulders in like the thoracic region of his spinal column. Goodness gracious. So if you just have a slight tilt, like you're kind of like, okay, like just looking at your phone glancing. Now the weight, because of the different angle, the weight of your head is now set 27 pounds. We double that, we go to a 30-degree angle. So it needs a little bit more of an incline. You're looking down. 40 pounds. Okay, so now the same vertebra have to put up with that much more weight, essentially, that much more force. We get up to a 45-degree angle. Now your head essentially weighs almost 50 pounds. Okay, think about how much 50 pounds actually is. Your neck is rather delicate. Okay, it wasn't just Anne Boleyn's neck before she got executed. All right. And if again, if you go all the way to full 60, like what I see a lot of times from you guys doing in the hallways in class, just full on, just boom, phone, your head now feels like it weighs 60 pounds to your neck. It can't sustain that for a long period of time, guys. And this is a very recent, and in my recent, I mean the past 20, 30 years, phenomenon that doctors are seeing with their patients because guess what's gotten fancier in the past 20, 30 years? Cell phones, PDAs, laptops, all that stuff. Okay? So I say this because I love you. Put the phone down. Not just because I want you to pay attention, listen to me yak. Please put your phone down so your neck doesn't hurt. Okay? Then we have some different types of curvatures that can happen for um, different reasons, be it congenital, so like maybe you're born with it. Cut, leave her alone. I swear to God. Cut. Or some situational induced. So an abnormal curvature of the spine is called kyphosis. Um, I remember studying this with one of my with my Egyptology degrees and realized because there are certain mummies we have found with clear kyphosis, including King Tut. King Tut very much had to, there's a reason we found all those canes in his tomb with him is because he had to walk with a cane, one because of the kyphosis and two because of the club feet, but he was also severely inbred. So this is, remember my yearly PSA, don't marry your siblings. Um, so kyphosis literally means hunchback as an old term. Kyphosis is the actual medical term. That's what I would ask you on a quiz. Okay. So you can see there's three different spines here. Here's our normal. Again, it has a little bit of curve to it. That's fine. We want that. We've been over this. So then we have kyphosis. You can see the what we call like hunchback is where you can the back is more rounded. Okay. So my grandmother, before she passed, actually developed kyphosis, and she had this going on because she had osteoporosis. So remember, osteoporosis is where your bones start to kind of wear away over time, and they're not being rebuilt. So her curvature of her spine got out of whack. Here's the red dotted line for context for normal, and it made it to where she was actually like hunched over all the time, and that's incredibly painful. And you do see this a lot with older individuals, or in some cases, if there's been some sort of medical situation. Okay, then we have lordosis, which is extreme lumbar curvature. So again, follow the red line for normal. So in this case, you'll notice this lumbar section is kind of more like into the middle, like into your abdominal cavity almost. Well, it's then going to push out whatever is in front of that, your organs, and so they're going to be more pronounced. This is very common in pregnant women. If you've ever seen a very pregnant woman, 8, 9 months pregnant, she kind of waddles, right? So pregnancy does a number of things to your body, one of which it can cause this lordosis, so you have this extra curve to your lumbar section of your spine, which is going to then stick out your stomach. And because of the craziness of pregnancy, they also have connective issues with their tendons and ligaments and things like that. So things are looser than they're supposed to be. And so they kind of waddle because their legs don't quite fit under them the way they used to, and then like the everything that's connected is stretched out, so to speak, or loose, and it's not connected right, and then you got this weird curvature of the spine going on. That's why it looks like they're waddling. Okay, and plus they're carrying around like basically a watermelon. So be nice to pregnant ladies. They got all of this nonsense going on, and their feet swell. Oh, it's terrible. Um, totally have children if you want them. Okay. Last but not least, you can also have something called scoliosis. This used to be a very common test. I think they still do it for some sports physicals, but they want to see if your spine curves sideways. Because for certain sports, you can't do this safely and be in the sport if your spine is curved sideways. It's not safe. You'll notice that somebody has this, so they're going to look for one. The doctor's going to kind of look at your back and see if the spinal cords line up. But they're also going to notice if like one shoulder is higher or lower than the other. Like it kind of had like this going on. And you can also see it for hips because guess what? Remember that bilateral symmetry? You're mirrors of each other. So if one shoulder's lower and one's higher, your hips are going to counterbalance that because they're going to try and make up some lost ground. So about 2 to 3% of the population has this. So that's fairly common. There are different treatments available out there, different therapies. I remember I went to school with a girl who had slight curvature like this. And so she carried around a little brick she had to sit on because one side was higher than the other. So she would sit on the on the lower side, she would sit on that brick so she would be flat and it could even be even in her chair, in her desk. Because otherwise she'd like literally like slide out of her desk. It was wild. So it's more common than you realize, and you may know somebody with it. Okay. Okay, I'm going to hit stop. Stop recording. Where is it?